Your time starts now.
You are in ST5, doctor working in the adolescent gynecology clinic. You are seeing Mrs. Sarah Brown, who has been referred by the GP regarding concerns about her early puberty in her 7-year-old daughter Emily. Okay. Considering mother's concern, you will be interacting with the mother of the child. Okay, so this is a precocious puberty. Mm, Precocious puberty. Okay, referring with Emily Brown, a 4-year-old, 7-year-old girl who has presented with the breast development noticed over past 3 months. Her mother also has noticed some puberty. We have to let her to attend
Your time
the.
is up, doctor.
Okay. Hello, I'm Dr. Sugita, one of the doctors in the clinic today. Am I speaking to Emily's mom?
Yes, doctor. I'm Sarah, Emily's mom, doctor.
Can I call you Sarah?
Yes, yes, doctor. Yes.
All right, Sarah. I can see from your GP notes that you are having some concerns regarding your daughter's breast development and early puberty issues. Am I right?
Yes, doctor. I'm really worried about what's happening with her, whether the things are going on the track or not. She just 7 years, not even completed 8 also. And I noticed that her breast is developing now. And basically, I noticed that in last 3 months back, but over a period of 3 months, I am noticing that she has developed quite good size breast. And last month, I also noticed that there are some hairs down below. I really don't know whether this is normal or not, because I myself had my periods maybe around 12 years or 11 years of my age, and she is having breast development now. So I'm worried whether she'll get periods or something like that. Can you please tell me about it, doctor?
Well, I do acknowledge all your concerns. Before that, I would like to ask you a few more questions to know more about your daughter. I think Emily is with you here. Am I right?
Yeah, yeah, yeah.
I will also examine her with your permission. And also, I will be writing back to your GP and involve my consultant in her care. Is that okay?
Yes, doctor. Yes, that's fine.
So, as you said about the breast development and pubic hair, can you tell me more in detail? Did she attain menarche? Did
No,
she get a
no,
period?
no. She didn't get the periods yet. But I was thinking that whether now, because there is a development of the breast also, so whether she'll get the periods also.
Okay. And is there any hair growth elsewhere in the body other than the pubic hair? What about the armpit?
No, I don't think so. But down below, she has got hairs, doctor.
All right. And any lesions you have found in her body? Brown lesions elsewhere?
No, no, no.
And any other hormonal problems in the family or in her?
No, doctor, no.
And when she was born, was there any congenital problems in the brain or any like hydrocephalus or meningocele? Did they mention anything?
No, no. Everything was normal up till now, doctor. Everything was normal.
Okay. And all her developmental milestones were also normal. Am I right?
Yes, 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 yes.
Um,
I just noticed that she is becoming tall as compared to her school friends. This also I
mhm.
noticed.
Okay. Okay. And did you try any treatment for this before?
No, 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 doctor.
Is she feeling lethargic or any loss of appetite, loss of weight recently?
No, 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 no.
Okay. Any allergies?
No,
Any other medical conditions?
no.
She has any siblings?
No, doctor.
Okay. So you said you attend your menarche by 12 years. Am I right?
Yes, yes, doctor.
Her any surgeries in the past?
No.
How is her school life?
Yeah, she's quite doing well in the school, doctor.
And she is at home, right, with you?
Yeah, yeah. Yeah.
May I know her BMI if you are aware of?
It's normal, doctor. The last visit, the GP told me that it's normal.
All right. Thanks for all these informations you have shared. Now, with your permission, I would like to examine Emily to see her general well-being. I will also assess her hair growth under the armpits and the breast staging I will be doing, which is called Tanner staging, and her pubic hair also. And we'll see for any lesions in the body. I will also check her tummy to see if there is any abnormal swellings or any pain. And also I will order for, after the examination I will be ordering for certain other investigations. Also I would like to have some personal conversation with Emily, if you would allow.
Yeah,
Okay.
that's okay, doctor. You can examine her and can have later on some conversation also. No problem.
All right. So then I will be ordering for certain investigations, including the hormone profile, the which is called as LH, FSH, and then her female hormones, the testosterone, the estrogen, testosterone, and some. These are all hormones. Also, the thyroid profile I will be checking, and also other hormone test called GnRH stimulation test, adenocorticotropic stimulation test. I please don't think it is overwhelming. These are all some of the hormone tests I need to do to find out the exact cause for your daughter. Is it okay? And also, I will order
Yeah,
for.
doctor. Yeah, so lot of tests are required for this, doctor. Is it something abnormal or something like that?
Well, is the if it is, if she's attaining puberty less than 8 years, we call this as precocious puberty. Have you heard about it?
No, doctor, no.
So less than 8 years of children, if they attain menarche or any changes in their breast, according to the staging, we classify them, and we call this as precocious puberty. This is, as we see, this is not quite normal. There can be some underlying causes for this. However, most of the time it can be idiopathic also. In 74 out of 100 times, it can be without any reason. They can attain menarche at earlier time. However, there can be some underlying causes which can be problems in the brain, like any tumor growth or any hormonal imbalance is causing her such defects, or locally in the in her ovaries, if there is any hormone secreting tumors, or in the gland called adrenal gland, which is found top of the kidneys, there can be some growth which is releasing some abnormal hormones, or it can be because of some other syndromes like Cushing's, or congenital adrenal hyperplasia, which we see. Please don't mind me telling all these. These are all some of the hormones, some of the problems which can cause precocious puberty. So, in order to know what is causing her the problem, we need to order all these investigations. And also, we need to check her bones. X-ray for her bones need to be done to check if it is really a precocious puberty, or if it is in accordance with her age. We need to check her
But
bones.
doctor, why in her case so early she has started developing this? Why so early?
uh, so yeah, that is what, there are several reasons, the underlying causes we need to find out. There can be these all causes can cause, or it can be a separate isolated cause also. Just she may not attain her menarche, but only the breast may be developing over time, or they can be only pubic hair growth, which we call it as isolated growth, which is okay. We can just give her some medications to delay her periods onset in that case.
Okay, okay. So we can halt this, or is it necessary to halt it now, doctor?
Well, yes, it is important to delay her periods onset, and we need to regularize her hormones so that she will attain her desired height. It will not be stunted because of the hormones which you are going to give her. So this will be the main goal of treatment, to delay her puberty, because if she gets her puberty earlier, there is chances that she may go for early menopause, and there are some other hormone related issues she might face in future, like during her fertility times and all. Am I clear so far?
Yes,
And when
doctor. Yes, yes, yes. So we will have to do certain blood investigations for the mainly hormonal investigations. Anything else, doctor, we should do for her?
we need to do her the bone scans, to see if there is any to check a bone age, and if there is any multiple fractures, it can be some other problems like McCune-Albright syndrome we call. So we need to see if there are bone fractures in her, and also CT and MRI of brain may also be needed, and also her urine test to see the hormones, that is cortisol, steroids in the urine we will also check. These are all the relevant investigations we need to work up.
Okay, doctor. Okay. So
To
we'll
the
get some investigations done for her. Yeah.
And she will be cared, after that, she will be cared under a team of doctors, including the adolescent gynecologist, my consultant, the pediatric adolescent gynecologist, and the counselors, the hormone specialist, the scan doctors will all be involved in her care. And what we will do first is to give her some medications which will cause her to delay the
Time
periods.
is up. Time is up. Time is up.
It's a lengthy station.
Now, this was quite okay station. Means I'll say this is pass, borderline pass station, definitely not a failed station. But overall, you need to avoid medical jargon. Okay.
Yeah, I
And
don't
say,
know how to tell that.
yeah, I'll tell you. Now here, the focus was that you need to address the concerns of the mom. Her main concern was, is this normal? Okay. Second, she is asking what will happen further. If do we have to halt this? Okay. So these were the two clue points in her case. Now, basically, the cause of precocious puberty, it can be either central or peripheral, and then you need to explain her. You put everything under the hormonal imbalance, but start with the HPO axis. There
Mm,
can be the certain, how does it starts, you explain that HPO in a layman's language, certain hormones come from the brain, okay, and they act down below, and then these are the changes which what we get. Okay, so that could be one reason. Second, it is not happening centrally, but by external source. And one more thing, you need to ask about the medications, because the source of the medication, uh,
yes,
the source of the hormone sometimes can be iterating from the outside also. Maybe unknowingly
cosmetic.
the child is taking mom's oral contraceptive pills, or maybe some testosterone gel, or some HRT preparation which is available in the home she is taking. Okay, being a child, these things do happen, and there is some external source, or some creams they can apply because the mom also applies. Okay,
Mm,
and sometimes there is a passive transfer also, if they are sleeping together and close touch with the mom is there. Okay, in that particular case you need to ask those histories. So some external source of hormone also we need to rule it out. Okay, so overall this was quite good station, but I specifically feel that the central puberty and the precocious central and the peripheral puberty, you need to tell that our focus is to find out whether this is happening mainly central type of puberty or the peripheral type of puberty. That if you tell that, the examiner comes, no, your line of thinking is correct.
okay, okay.
You got it, what I mean to say. When
All
we
the
talk about,
causes, instead
yeah.
of telling all the causes and the diseases, I can
Yes,
tell
yes, yes. See,
the cause.
basically, there are puberty. What we call this in our medical terminology is a precocious puberty. That means these changes have started developing quite early. The cause could be somewhere in the brain. That is the central type. Okay, it is coming from above. There can be source which is not coming from the brain, but somewhere else, either in the body or sometimes from the outside also. Okay, that is the way. Okay, just hold on. Someone has come. Just hold. Hello. Yeah.
Yes.
So you need to tell and then rule out certain things. Okay. So what happens? The examiner is assessing your way of thinking. Okay. So I'll explain this in the slides. Okay, I'll explain this. You are able to see the slide?
Yes, sir.
See, these were the role players instructions. Okay, if ask the role player opening statement, if the doctor asks how they can help, doctor, I am really worried about my daughter Emily. She is only 7 years, but breasts have started growing, and I have noticed some hairs on her private area also. So there are some certain instructions which are given to the role player, and they are just repeating those things. Okay, she is telling that I started my periods around 12 years of age. Then emotional, is there something wrong with her? Will she start her period soon? Is this going to affect her childhood? Okay, certain are emotional questions. Okay, and here maybe role of counselor and all, you just need to touch upon it. Okay, you need to just touch upon in this case. It's not like a domestic violence where you have to go into the too much of details. Okay, behavior during the station, you are worried about, but polite. If the doctor explains clearly, you become reassured. If the doctor uses complicated medical language, say, sorry, doctor, I didn't quite understand that. Especially, I wanted to say this when you are using the syndromes and all those things. So there are certain clear instructions. So try to make the things simplified. Okay. So now coming to the information gathering. So candidate
So,
should
sir,
explore.
I take those
Yeah.
names or shouldn't use those
Uh,
things?
no, there are certain conditions which are known to be associated what we call it as syndrome and all, but basically it is impossible to get those names in that particular. And what happens most of the time we are thinking. So please, if it is easy for you, put that, but that will not add additional marks. I'm telling you. See, telling the central precocious puberty and peripheral puberty, explaining this will definitely fetch more marks rather than telling the
Hmm.
name of the syndrome. This is what I
Okay.
just wanted to convey. Okay. So focus information gathering. Candidate should explore pubertal changes, breast development time, pubic hair, axillary hair, body odor, vaginal bleeding or discharge. So these are the things which you have asked basically. Growth history, recent growth acceleration, the role player only volunteered. Change in the clothing or shoe size can be history. Neurological symptoms, headache, visual disturbance, vomiting, seizures, hormone exposure, estrogen creams, medications that I told you, family hormone therapy if someone in the family is taking hormone and the child is taking accidentally, family puberty history, age of puberty in the mother, she has volunteered. So psychological aspects, child's emotional response and concerns of mother. Patient safety, candidates should recognize red flag causes of precocious puberty, important safety considerations, possible underlying causes, CNS tumors, ovarian tumors, adrenal tumors, exogenous hormone exposure. So these basically you have asked relevant histories and you have suggested relevant investigations also. Okay, appropriate investigations, candidate may mention hormone blood test, LH, FSH, estradiol, bone age X-ray, pelvic ultrasound, MRI brain. So this all you have covered. Okay, referral to pediatric endocrinology. And then another safety net advice is candidate should advise mother to seek review if there is a vaginal bleeding, rapid progression of puberty and neurological symptoms if the child develops. Okay. Then communication with the patient and relative. Candidate should demonstrate empathy. I can understand. Yes, one thing I wanted to tell you, when you acknowledge, especially with the mother is there, no, I acknowledge you as a mother and your concern towards your child. Okay, so that is the most important thing. Okay, I can understand why this would be worrying for you as a mom. Okay, so if you have certain set of sentences with you. Okay, so just acknowledging the particular thing and acknowledging in this particular way matters a lot in the examination. Then clear explanation, avoid complex terminology. Explain precocious puberty means puberty starting earlier than expected. Reassurance, important points that many cases are benign, often no serious cause is there. And addressing concern that candidates should address fear of serious illness, fear of early menstruation, and psychological impact. Okay, so these were especially here the central and peripheral was the most important thing which was expected. Okay, but otherwise you have covered this particular scenario except that medical jargon. I felt overall the task was good. Okay.
Yes, sir.
Hello, doctor.
So,
Yeah,
treatment
yeah.
will give that the GNRH analogs.
GNRH analogs. Treatment is here. We need to halt these changes, and we will give certain injections, and the changes will be, kept on hold for certain years. And this is important for her growth also. Okay, so these were the things.